Good morning, everyone. Today we have with us Professor Alan Dilani. He has developed and implemented the theory of Salutogenetic Design approach at the Karolinska Institute in Stockholm. His research has been adapted successfully in design and public health policy projects around the world, propelling positive impact on human health and well-being. He's also the founder of International Academy for Design and Health. Hello, Professor. We are very pleased to have you with us. So just to begin with, if you could tell us a little more about your background as an architect, as a researcher, and as someone who speaks 7 languages and has traveled to 90 countries, it would be really interesting for us to learn from that enriched experience that has contributed to your journey as a scholar in this field.
Good morning, Aishwarya. It's a great pleasure to be with you, and thank you for also this opportunity to share my experience, knowledge. I am a background architect and educated in Italy. I came 87 to Sweden. I did my PhD on environmental design and healthcare design. Then I went to medical university at Karolinska Institute. I developed my postdoc and also my research, and finally my research center at Karolinska Institute, Design and Health, and International Academy for Design and Health that engage worldwide academia, Ministry of Health, government around the world, but also private sector industry to discuss the interdisciplinary approach of design and health, but also the issue, the general task that different disciplines should deal with relation to design and health in order to create healthy city, in order to create institution, environment, hospital, housing, whatever, a workplace that really promote people health. You know, before this discipline, architect has been always successfully designed in order to shape the design that is attractive, that is functionally in highest level. But really, few of them thought about the impact of architecture to health. For me, it was most important the hospital as a city, as a kind of institution. Within the system of the city, we have a system in the hospital that all these should be related to health promotion. But this idea is also, it's come as obligation from World Health Organization that we must create health within the setting, within the city, within the environment, within the place that we live, we work, and play. And that's very well known. So if we look the definition of health, for example, health state of complete physical, psychological, and social well-being. And this 3 dimension of health is not really well respected in the society. And in the society, the health only considered as physical, which is not correct. And entire medical science also related to actually to physical, not really to psycho and social. And that is the second and third dimension of health. But when I came to Karolinska Institute and with my colleague, we studied health, we consider health as approaches. We have considered health as approaches. We come to that conclusion. Health, it's happened through interaction with the environment, with people, with our experience, all that. So we have found that health as a process composed of psychosocial factor, lifestyle, emotion and experience. And emotion and experience was central part of health. So we have find out people that have strong emotion and experience, they had really good health compared to others. So, and we have found that these two components of health process, emotion and experience, is highly related to the quality of architecture, to design, so that we experience and affect our emotion positively. So my task as architect within the medical university and with psychologists, with sociologists, with the medical doctor to discuss this, how we can create an environment design that really affect, first of all, our lifestyle for healthy lifestyles behavior, but then later on how emotion and experience could have positive impact of our health and well-being. And finally, we come to conclusion of the salutogenesis in the public health, how salutogenesis could be applied to the architecture within the environment worldwide. And that idea has been integrated, salutogenic design, at Karolinska Institute and spread in the world arena in all kind of discipline in within our network, International Academy Design and Health. And we have developed a principle of design and health, how to be applied in order to create healthy city, in order to create a healthy school environment, healthy hospital, healthy housing. All these phenomena and design factor within the public institution and the city worldwide could be applied and change our health behavior, healthy lifestyles behavior, actually, in order to promote our health. And one of the main tasks of World Health Organization, actually, how to reduce non-communicable diseases. And non-communicable diseases, like all kind of what we call lifestyle-related diseases. And lifestyle-related diseases is the most dangerous in our planet right now. United States pay almost 80% of entire cost for healthcare to non-communicable diseases, lifestyle-related diseases, which could be prevented actually. Diabetes, many cancer, and digestive, heart, hypertension, and many cancer. All those diseases within our society is the result of our unhealthy lifestyle that we could, through design, infrastructure, we could prevent. And how we can prevent? Actually, if we every day exercise 30 minutes regularly, and also don't smoke and don't eat McDonald's, very simple, nutrition, and don't smoke and do exercise, we can prevent all these diseases, very simple. So, and instead of Coca-Cola, we can drink the water, and that is the most reliable for our healthy lifestyles behavior. So this was the foundation of how we can develop. We have applied, actually, we have developed salutogenic design principle, and we have applied, and we give many prizes worldwide for healthy city, healthy environment, hospital, healthy workplace, healthy offices, product, etc. That is how comes, and we develop more or less also how to reduce stress, because the salutogenesis is the foundation of salutogenesis, how to actually increase our capability and coping strategy to actively prevent stress in the society, you know. And in order to prevent stress, we must understand what is stress. But also, actually, stress is also coming from the design, which is very interesting. The founder of the theory of stress, Leonard Levy, which was my chief actually, and Psychosocial Institute and Public Health at Karolinska Institute. Leonard Levy came with this theory on behalf of World Health Organization. He developed the theory of stress. It's coming from the physical environment, the city, urban planning, architecture, that creates social organization, structure, and function in our society, which develop to psychosocial stimuli, interaction with people, and psychobiological program in our body, tension, heart rhythm, blood pressure, all this together physiologically with psychosocial stimuli that you get from the interaction with the environment. These together give a mechanism that we call stress, and later precursors of diseases, and finally to diseases itself. So stress is also a process, exactly like a health. So the rule of architecture, healthy built environment, how actively prepare people to coping strategy with stress and promote our health. And but to prevent stress and to coping strategy with stress, we need all of us to have a strong sense of coherence.
Yeah.
Sense of coherence means simply whatever we do, we must understand. This is, according to Aaron Antonovsky, comprehensibility. Everything starts with that. Whatever we do, we must comprehend. Comprehensibility, life as world is understandable. Okay? And then secondly, whatever we do, we must have enough resources to meet the task, which means manageability. And the third component of sense of coherence is meaningfulness. Whatever we do must have meaning. So life is meaningful and kind of rewarding for our brain. So in order to manage stress, we must have strong sense of coherence, and we can measure sense of coherence. Each of us has different ability to manage stress. This depends on our earlier environmental influence, earlier cultural influence, and things that is stressful for me is not for you, or vice versa, because if people has early stage has exposure for very strong environmental experiences in the city like New Delhi, when you come to Stockholm, so you find a paradise. The things that is stressful for people in Stockholm, for you, is not stressful at all, because you have the background of New Delhi. You have your own references. So the people living in Venedig, they couldn't come and live in Milano because of the traffic, because In Venedig, there is no car. So they experiences and they used to that. But also there is the theory of adaptability, and people will adapt sooner or later. But this level of stress will destroy us if we are not able to cope with that. And we cope with that, we need this comprehensibility, manageability, meaningfulness. So this is the foundation of salutogenic design, that how we can apply wellness factor that stimulate our brain, that we have a stronger sense of coherence, that we can manage stress and capable to do that hard task. So this sense of coherence measurement we did, we applied for healthcare. We measured the healthcare staff, and many industry now, they're using this in order to understand their staff how to manage high stressful level of work environment, like underground, like NASA will use this, they use this. Those very stressful environments, like pilot, I mean, they must have very high sense of coherence in order to manage stress. So this is the basic actually for salutogenesis. And this is interdisciplinary knowledge that we must really apply to all what we do, and especially to all kind of environment that could promote our health, but also prevent stress.
Yeah, that seems very well put together, isn't it? Like, if you are able to alleviate stress by supporting a cohesive worldview while facilitating sense making in people, I think health, especially public health, might be much more achievable. And you also mentioned that sense of coherence can be measured. Now, what I find interesting about this approach is that it connects people and places. So, if we can measure a sense of coherence in a particular environment, say if people are, say if a person is in a healthcare setup, um, what exactly do you think we can measure in this interaction between a person and, say, the lobby of a hospital? What are we measuring?
Yeah, I mean, yes, there is, I could have my PowerPoint presentation to you actually show exactly what is salutogenesis and what is not salutogenesis, and how was before and how we have transformed to salutogenesis. Then you can see the differences. Let's say I can show you actually some of these. Maybe it helps much better. But if I just say as a text, I explain, when you come to an environment, large institution, you must feel welcoming. Welcoming is the central part of the first environment that you see and you meet. And welcoming, how you can do it? Yes, you can do it through green. You can have green environment right in the beginning, in the entrance. You can have water fountain, sound of the nature. We can have transparency, that you know where to go. There is no problem of wayfinding. So you can see psychosocial stimuli right in the entrance that attract you. You see the daylight, that you know where is, and there is more transparent actually. So this is, I think, this design factor that we can identify that fit to the this environment. So it is very important that we can bring interdisciplinary global knowledge perspective, how to adjust to the local identity of the place, culturally acceptable. You cannot bring culturally things that you are living in Sweden from India, because then people could not understand. But the same thing that you cannot bring to India. So this is very important. Let's say, for us, it's most important to see health relation to built environment and city planning. You can see we have 50 countries healthiest in the world. Sweden is number 8 where we're living, which the median life expectancy is 88 years. But Italy is number 1, for example, despite of the economic crisis and unemployment very high among young people, but Italy, struggling economy, has the best health in the world. It is not about cost investment on hospital. You know, United States, despite of 20% of GDP they're spending for health, but they are number 34 in life expectancy. So this is very important to mention. This is compared to country like Singapore, for example, they are number 4, but they spend only 4% of GDP for healthcare to treat diseases. So this is very important. Many countries in the world, they look health related to how they spend resources for healthcare, which is not the case.
Yeah.
So if we actively educate people, education is number 1, and provide the condition for them to keep their health, they are most powerful instrument in the society to create healthy environment and educate people for exposure of healthy environment. This is better than hospital.
Of course, yes.
So we don't need the hospital.
Yeah.
Because the hospital is pathogenic. They're looking for causes of diseases.
Yes.
And they cure the symptom of diseases, not the origin of diseases. So it's very important. The causes of diseases is completely different. Which in healthcare, in hospital, they don't care about this. We have not public health promotion in hospital. We have not health preventive in hospital. Disease prevention in hospital. We have just pathogenic, looking for how to cure diseases, and we look at symptom of diseases because the pharmaceutical industry, they are very powerful in the Western culture, and they invest a lot of resources in order to commercialize the healthcare. And the health is not healthcare, is diseases management, which is highly commercialized in the Western culture, in industrialized world, by pharmaceutical industry like AstraZeneca, Pharmacia, and all this big industry, which they could easily also could look on the health process to commercialize health and promote people for healthy lifestyle and keep their health. So we have developed 8,000 diagnoses.
Mm-hmm.
That means 8,000 sickness. The medical science is the most advanced, but the medical science has always deal with the symptom of diseases. And this is the dilemma of the many government society. They point of departures looking for how to treat diseases instead of how to keep diseases away, to prevent diseases and keep people healthy. Myself, I am 63 years old and I have never been hospitalized. I have never been used one pillar and never drugs, and that's all because I don't drink Coca-Cola and I drink water and a glass of wine time to time, never alone with company, and never eat McDonald's, and I do exercise every day and don't smoke. We know smoke is the most dangerous in our planet and kill 50% the causes of death is of smoking. So tobacco industry, how to prevent tobacco industry? This is also other dilemma. You know, this is the causes of non-communicable diseases that government has not been paid attention. So this is how we can deal with that. And the main idea is how really to provide and introduce more wellness design factor in the society, in the city, in urban planning. This is the most cheapest way, also investment to keep people healthy. But we need a leadership of government, not only from Minister of Health, we need Minister of Education and Minister of Planning and Minister of Health coordinate, work together in order to prevent diseases and promote health. And we can see in the small community of city, look how much money in the budget of municipality go to healthcare that poorly related to treat of diseases management.
Mm-hmm.
And how much money goes to how to prevent diseases and promote health. So if we can identify all those risk factors, screen people in the community of 20,000 inhabitants, screen people and see the causes of diseases and the causes of death, we can find the major issue is environmental issue and tobacco and unhealthy lifestyle related, and some, of course, biological. We cannot live 100 years. Sooner or later, we die biological, but it's only 20% is biological.
Sure.
The rest is the factor that really is related to environmental, related to lifestyle, unhealthy. So we need clean water, clean air, clean land is the fundamental for our health. These three components. But then we need educate people for healthy nutrition, healthy lifestyles behavior, and in order to prevent hypertension, many cancer, diabetes, and digestive diseases that is most killer in this planet. And of course, as I mentioned, is if we extra create an environment that actively, educatively prevent people from diseases and prevent them for psychosocial stimuli, of course, we can promote health. So that is how come relation to design and health as such a important, such a crucial, but unfortunately in our society,
Yeah.
now Western society knows better than most other countries, probably, but in other third world, especially, I mean, in India, in Asia, they don't know at all about this kind of very, especially, I mean, from the government decision maker. They don't pay attention to that because they are not looking interdisciplinary, but also their resources is limited. They think that if they take care of uh, management, diseases management is enough, which is not the case. So that is how come salutogenesis and how we must really apply this knowledge interdisciplinary with psychologists, with sociologists and doctors and architect, city
Sure,
planner.
sure, Professor.
Health is crucial.
Just to add a comment there, though, actually coming to India, I'm not entirely sure if this knowledge of, or like this education related to interdisciplinary approaches to design is something that is missing from the society. Because I think as a culture, as a grassroots up, uh, way of living that we practice, I think India as a country and as a subcontinent by nature is very used to complexities and sort of looking at a problem if it needs to be solved from multiple perspectives. So I guess the problem that might be there might not really be the same as in Western countries or the global North. But I guess in the global South, it's more about raising situated consciousness and sort of giving a voice and agency to the people who know these things, but also to be able to act upon these um, intentions that they have. So I'm guessing at some point in the future, in the coming years, there will be more awareness about how there are existing knowledge systems, traditional ways of thinking, and also very widely occurring mechanisms within these cultures to naturally approach a certain problem from multiple perspectives, multiple disciplines, and also sort of taking action with multiple sectors together and also multiple stakeholders put together and sort of coming up with a cohesive plan that can be executed. So I guess in that sense, your research and your body of work that can be summarized as salutogenic design or salutogenic approach to design provides a very good thought leadership in that domain. So just to wrap up this interview, I was wondering if you could comment on what your ideas for a conscious Stockholm can be. If a conscious city is a city that is aware and responsive to the needs and aspirations of its people and communities, what do you think the future of Stockholm as a city that you have worked in and lived in for many years can really be
Yeah.
like as a conscious city?
Well, Stockholm City has very special problem. Stockholm City has tremendous opportunity actually to become healthy city. But the major problem of Stockholm is political. It's political agenda that they ignored immigrant in these countries, and they for many years they have not paid attention. Many immigrants, they live in suburban area, connection city, and they become completely third, fourth class of the society. And as the consequences of that, the criminality has been increased, and so organized the criminality has been increased dramatically because the city structure has not allowed them for healthy exposure to these people that living outside of the main area, like the center of city, which nowadays is the most destructive social environment for living, because it's simply for rich people that can allow to live there. Square meter is more than 100,000 crown per square meter, which is and 50% living. They are alone, single people. They could live in this area, and this is the policy of government that completely pathogenic in that sense. They have not paid attention to the interdisciplinary approach. And to be honest, they have destroyed the politician. And they are main responsible for what happened in Stockholm. Not only Stockholm, actually, I must say large city like Malmö and Gothenburg. Those three cities as large, it's the same character. So they leave them to the builder, that how they wanted to build and how maximize their profit of that, and commercialize the housing instead of paying attention the quality of built environment can actually social determinant of health could be respected. You can go to Finland in the Helsinki, in the central of the city, you can find renting apartment, which you can never even dream. In Stockholm, you can find the sign for renting apartment in the central of the city. So that is the problem that we have, unique problem, I must say, in the city of Stockholm. They created a ghetto. They created a center of the city that is really now, it's just for rich people, but also dangerous. If you go to restaurant, there is bodyguard everywhere. I mean, that is unbelievable. When I came here in '87, was not exist this kind of bodyguard in all restaurants. They are also, all these bodyguards, they are criminal people, actually. They came and they organize this kind of system that only rich people allowed to go to those restaurants in the night and move in the city. And it become actually very dangerous now. Where I am living in South France, that is peaceful, that is nice, that is calm, that is, I can leave my car wherever I go, and this, and nice environment. So this is the culturally, they have destroyed the city, which also the consequences of environment, they created a ghetto in different, like Rinkeby, like Husby, like Akalla, like South Stockholm, all this Warby, and this area become the center of criminal, young criminal group that's out of control of the government. You know, the city needs, first of all, safety. Safety is number one. Second is psychosocial stimuli and experience of people to feel good. And none of this actually exists now in this city. So that's why I don't believe this we can solve as long as the political agenda is not that, as long as the political agenda is not interdisciplinary. And this is a case for many years, and people, they don't have ignored. And also because of this now, some political party, they use this as their own agenda, like a racist party like Sverigedemokraterna, Swedish Democrat, which is mainly came because of the foreigner. But the foreigner in this country, they are contributed to the society in very positive way, in very progressive way, which has been ignored by this party. I mean, all Syrian, if you can see all Syrian refugee, they come to this city now, to this country. Majority of them now is working, and they contributed to the economy of this country. And very high level, actually, both level, high level and low level. But since the city structure has been not adjusted, to this social structure of the city. Is rich people is here and poor people is there. So poor people has no services and rich people, they have all services. So the criminal increase. They use these differences between rich people and poor people, and they become like now and out of the control.
Yeah.
So this is a dilemma actually we have in Scandinavia, especially in Stockholm, in social housing and social structure of the living environment is completely out of control, and they have no agenda, and the government is incapable to deal with this interdisciplinary approach to find the problem. So that is not been the cases, because it's simply government is have no vision. So we need the visionary government, we need the visionary people to tackle with this problem. So it's which is not the case.
Yeah. And if you had one advice for the interdisciplinary designer of the future, what would it be?
Well, I must say the interdisciplinary approach is like what they have done in Helsinki. They must learn from other city, Helsinki. They must learn from country like Singapore. They must learn from Asia that mainly they look how to keep people healthy. Salutogenesis come from the Eastern culture, how to keep people healthy. And how to keep people healthy must be the basic agenda for the government, based on that interdisciplinary approach to housing and build environment. So we cannot have this kind of ghetto environment that has become the criminal ghetto now, and people, they are not safe, they don't feel safe, and so it's just one kind of group go to live to one place and others go to central of the city that is most expensive, which is actually unhealthy. I must say, I will never live in the central city because of all this traffic pollution. This is not the quality of life. Even they don't know how the exposure for many cancer. The traffic is tremendous in the city, and we can actually transform to green by cover all the street and bring greenery and ecology and more walking zone, but also bring the same quality to Rinkeby, to Husby, to Akala, to South, to other places, and bring the job opportunity for them. This is also the Salutogenesis bring a lot of job opportunity for society, which is now the lack of these services. So we need more interdisciplinary, visionary people to the city of Stockholm, to the government policy, to see interdisciplinary approach, not only from the builder perspective and profitability of business of these builder people that they build. One of the most scandalous we have in Stockholm, you know, the Karolinska Hospital that we built on PPP, which is only one time we did in Stockholm. And this is the most catastrophic because no one take responsibility for that. Compared to Nordic country, we have no PPP for hospital, public-private partnership. They build a hospital that every Stockholm, we must pay a lot of taxes for this hospital, which is really profit-driven for those that have organized the hospital, not for people. And that is so scandal we have among builder and some organization that working with them to create this kind of project like PPP that cost 64 billion crown, you know, which means actually 6.5 billion euro, if I can say, the most expensive building in the world. Karolinska Hospital. So that is how it is, the politic of this city. That's the main reason that we have a problem, huge problem. And I think it's not, we need very strong leadership, political leadership that take care of that. And visionary. We have no visionary politician to deal with social determinant of health. And there salutogenic comes, and their interdisciplinary deal with the problem.
Well, thank you so much, Professor. It was a very comprehensive background and a setting for hopefully more visionaries to come forth and more interdisciplinary designers to come forth and join the movement of making Stockholm a conscious city in the future.
We hope so.
Yeah.
But I doubt, because I am living in this city 30 years. I know how it works.
Yeah.
When I came here, just to mention to you, the Minister of Foreigner was Mona Sahlin. I wrote a letter about complain about the situation, how integration of foreigner to this society. Believe me or not, 30 years later, it was the same problem in the same places. Never changed. For
Maybe
if
the change needs
30
to
years
come
it's not
from,
changed,
maybe the
it's
change needs to
difficult.
come from the bottom and not from the top, not from the government.
Absolutely, absolutely, absolutely. We hope so. New generation take care of this, and new generation with more visionary people, like once a time, Social Democrat Olof Palme created this society for welfare society, which is all is gone by the second generation of Social Democrat that has no vision on that kind of society at all. So this is the main problem. We have not visionary politicians to deal with the daily problem in our society, actually.